It's 9 o'clock, so we're going to go ahead and get started. Heather, did you start the recording? Okay, so Heather started our recording. So welcome everybody. Thank you for being here this morning. First of all, I want to apologize for last month. I had some major illness going on, and the last thing on my mind was this webinar. And thank goodness for Heather, who jumped on here, and I think Josh jumped on and handled the webinar. I don't know if Josh did. He's given the look like he forgot to.
Oh, no,
But
I didn't forget. Y'all said y'all had it handled. I didn't forget. Come
there
on
you
now.
go. There you go.
Hey,
But thank you to Heather
real quick.
who took over.
I don't, I guess I'm not going to stay down at the beach at Point Clear on Saturday night.
Paul, hey Paul, there you go.
Okay, there we go.
But thank you to Heather who took over, and Manhattan Life who did a great webinar. But I just wanted to apologize for that. But I think it went off wonderfully. So, but thank you for everybody who joined. And but today we are going to have a wonderful webinar handled by Josh Lawford, talking about marketing. And so we're going to get started and let him take over here. I'm going to share my screen with the presentation that we've got for today. So let's get that started.
Yeah, and let me start off by saying I see a lot of people jumping on that are seasoned agents, and that's a really good thing because I kind of can't see now but I did see like Jim and Paul and some other folks. Um, if you see anything that I'm talking about that spurs something in your brain, just speak up and talk. Um, the reason I wanted to talk about community-based marketing, and then talk about a few things you can say when it comes to referrals and things like that is because we are out of the OEP. We are into the rest of the year. And so now we have to be super intentional, super creative, and we have to make sure that we are getting off the couch every day. Okay. Whether it's, you know, however you do this, whether it's still the part time, full time, or whatever, you got to set a couple, days a week, I feel like, to be out in the field, community based marketing. Okay. And so we'll go over that. Lisa, you can go to the next slide. Things that we're going to talk about today is building community presence. We're going to talk about things that you may already be doing, Medicare one-on-ones, things like that. Establishing referral networks. That's the biggest thing, in my opinion. I know back in the day, Lisa and Aina Fowler had so many referrals coming in. All they did was they picked, like, I think one day a week just to go out. I think they were just hanging out just to have fun together. But if you're somebody that gets bored, hey, partner up with somebody. So we'll talk about that. We'll talk about staying compliant. And then what we do always is we want to provide value whenever we go into these locations, whether it be a doctor's office, whether it be a community center or whatever. You want to make sure that you're just not going in there with that salesman breath that we talk about, immediately, because we're helping people. This means a lot to them. The things we're helping them with. This is at this stage in life, this is like kind of a big deal, for everybody. So we want to make sure that we're doing the right things, putting people on the right plans. And so we want to do that, the right way. So, and then I'll just talk about referrals at the end. So the biggest thing is, building genuine community partner, um, relationships and creating that presence. So Lisa, if you'll go to the next slide. Um, we're going to talk about three little buckets real quick. Okay. First one is educational. Okay. Hosting Medicare 101 seminars. I know that I have a generic Medicare 101 seminar that we've updated with the new numbers. Okay. These, like it says on there, these are not sales pitches. Okay. These are not, like, even though that that's our ultimate goal is to educate, we want to get sales, but we want to make sure that we're coming in there with that, once again, that heart of serving people and doing those. You can do them at a bunch of different locations. When I get to talking a little bit about the doctor's offices, a lot of the value-based clinics in a lot of the bigger areas like Huntsville and the new one popping up in Decatur, if you're in Birmingham or wherever, Mobile, the value-based clinics, a lot of times they will let you actually go into their location. They have these community rooms and they'll let you do it there, so that's really good advertisement for them. And a lot of times they'll do some of the the email blast to the community and a lot of the things to get your name out there, hey, this person's coming, Mike's coming in next Thursday at 12 o'clock. And if you get to building relationships with these folks, that's going to be really good because they're going to, especially if you have it at the same time, just like we do this call every month, the third Wednesday. Isn't that right? Third Wednesday, Lisa? I think so. But we do it the same time every single week. So, but make sure you're out there, partnering with the different locations. Another big thing is we want to volunteer this time of the year. Okay. So I'm just asking out there, and you can just throw your hands up or do whatever, but how many people on here go to food pantries or churches or things like that during the rest of the year? Okay. So the reason we do that is obviously you want to wear something that says that I see Jim does that a lot. We want to, you to wear your name tag, things like that, and go out there, but you want to serve these people and you're going to get to know them at these locations, especially with the low income and things like that. Because remember, and I say this a lot, what we do now affects how successful our AEP and OEP is. Okay. So every time that let's say you partner with a doctor's office, you may build that list now. You may meet with people. You can't help them. Just remember, everything you do now has a purpose for later on. Okay. So you're building the AEP list. All right. And I know Rick Linder's on the call. Rick does a great job of doing that year round. Okay. Y'all don't laugh too hard now. I heard somebody laugh when I said Rick. But anyways, the biggest thing is be out in your community, you want to be recognized and things like that. Lisa, give us some experience about when you and Ana used to go out. People used to know y'all. They got to see your faces quite often at those locations.
Yeah, that's a huge thing. The biggest thing is just to wear something that tells what you do, because people are always going to ask. If you wear your name tag everywhere you go, it's, people are always going to look at what you've got on, especially a name tag, just because out of curiosity, they want to know why you've got on a name tag, so that brings attention to it, and it starts a conversation. But one of the biggest things that Ana and I always loved to do was when we went out together, of course, shopping is always a big thing for girls. So we used to love to go into stores. And one of the funniest things was we used to always say to the girl behind the desk or whoever was, working in there, we used to always say, now don't tell anybody we're in here because we're supposed to be working. And that would always create a conversation. And that person would say, well, what do you do? Well, there you go. That starts the conversation. And we would go, well, we work, with Medicare. That's what we do. And that person, regardless of how old they are, if they're old enough to have Medicare, then that person you can help. If they're not, they have a parent, they have a grandparent. So we would say, well, in order to make it, legit that we're in here shopping, we need to hand you our card. So make sure you give this to whoever we can help. So that made it worth our while to be in there. So that was always what we did the day that we were together. And we always saw referrals from it. So you can always get out and walk around, go shop, do whatever you want to do and make an impression on your community, whether it's wearing your name tag, a shirt with Alabama Health Guidance on it, whatever the name of your company is, or just get out and make sure you've got cards in your pocket. Another quick tip is to put 10 cards in your pocket and make sure that you do not go home until you've given out those 10 cards. And now I'm going to tell you, don't give out those 10 cards just so you can go home. Okay. They've got
Oh
to be
man,
legit giving those 10 cards out. Okay.
that's
They've
right.
got to be, don't just hand them to some kid standing on the corner. It's got to be a legit give out to someone, but you do not go home until you've given out those 10 cards. That's a good day. That's a good day.
And see, y'all, this is what we're talking about, being super creative like that. Now, Derek Gargis, do you think he loved that credit card bill when she came home with all that stuff that she bought from all those stores? Probably not, but it was creative, and we love it. So doing events and being consistent out in the thing, that whether, like I said, we have health fairs, the expos, things like that. But the biggest thing is, we know we show up at doctors' offices and places where we're connected in AEP and OEP. But if you really want to do that long lasting relationship, it's got to be year round. Okay. So you got to be consistent. And so if that means narrowing it down to this radius, I'm not, and I'm going to focus on this area, or I can only handle for myself 5 locations that I'm going to hit consistently, or 10 dental offices that I'm going to hit consistently. That's the big thing. Just do whatever, do what you can do and hit it hard. Sometimes doing too much can overwhelm you, but just be consistent is the big thing. So, and because the key is referrals, it says it down there. Agents who are the visible all year earn the most referrals. So, and that's a great idea, Lisa. Mike, you should go shopping today. All right, next slide.
Golf shops are great, Mike. Now listen, golf
Oh, this
shops, they need Medicare too.
I thrift shop and the men's store in Mountain Brook. When those folks they put up those Masters shirts for $5 with tax still on it. Hey, I'm there. They got my name at that place. All right, next slide. Okay, and this is just going a little bit further. Okay, making sure that we're, whether we're at medical professionals' office, the doctor's office is okay. Talking to social workers, I think that's huge. I know a lot of people that do that work with us, and just being consistent there. Biggest thing, get your name out. Okay, senior center directors, faith community leaders. Yes, even Rick Linder can walk in a church and he won't catch on fire. He's going to be good. Go out there and have fun. HR departments. Hey, if you ever talk to large employers and you want a presentation on Medicare, for them, I have that. Okay. So if you ever want to go see a certain thing, just say, hey, let me reach out to Josh. He may have a presentation for that. So after this call, if you need a Medicare 101 or you need that HR slide, y'all reach out to me. Okay. Financial and legal things, financial advisors, serving retirees. I know for me, when I was first came over to this side, I would meet with a lot of financial advisors trying to get them in the business. And two things happened for me. Either I got them on board to add Medicare to their thing, to their portfolio, or they were a referral source. Like I never went in and without unless they were already working with an agent. I always came out with something that I could help people with. Okay. So just remember, now it says down here, I put this down here, no compensation for referrals and things like that, but they do. I don't know if you remember, if somebody has their life and health license, there is something you can do there, a little bit of fee there. If anybody wants to take that further, I'm not going to say that on a recorded line, so we'll talk later. But there is a few things you can do. But build genuine relationships first. Make sure you're bringing folks, donuts, coffee, whatever you need to do. Just be consistent. And I know I keep saying that, but be consistent. So, and then once
Josh,
again, yes.
I want to go back to to faith community leaders and churches. Just remember, I don't know if you're aware of this, but people call churches all the time and ask for money and ask for help. You wouldn't believe the people that are out there and they call and say, look, I can't pay my utility bill, or I can't pay my gas bill. Can you help me? I mean, they call all the time to churches and ask that. Even if they don't go there, they call their local churches and they ask for help. And a lot of churches will help them or they can't help them. And so that's definitely a way for you to work out a relationship with maybe a church secretary. So if you go in and build a relationship with that church secretary and let her know that, or him know, whoever's working at that desk, what you do, that you have a way that if someone calls in and if they have Medicare and Medicaid, that you offer plans that can possibly help them get a card that allows them to help pay those bills if they qualify, that you can help them pay those, that you are available to help them do that, because possibly the church can't, because there are times where the church has to say, well, no, we don't offer that, or we don't have the money to do that at this point. But I have someone that you could possibly call and they might be able to help you. They could pass your information along, because a lot of times the church does have to tell them no because they don't have the funds to do that. So they could help them, they could just pass your information along. We used to build that relationship with that church secretary. Now, you can't always, you might not get phone calls that you want because maybe that person doesn't have Medicare and Medicaid, and you might get a little frustrated. Well, this lady's sending me all these people that call me and I can't help them because they don't have Medicare and Medicaid. But you weed through those. But, maybe 10 people that call you, you get 2 sales. Well, those 2 sales to me are great sales,
Yeah, well, you can always, those other people, Lisa, you can go to, we remember we have the website findhelp.org. Well, you
That's
can go
right.
in there and look for assistance for them, and hey, say, but you can still guide them, and maybe you guided them, and so you say, hey, don't forget I help people with Medicare, and so then you've gotten 3 people back for just helping somebody. Just like when we tell people no, stay on that plan, you're on the best plan, you end up getting more back from that. So
That's right.
Mhm.
But it's building that relationship. And that's the way you can do that through a church, because people are calling that church office all the time. And if you just build that relationship with that lady and let her know the things that you can do for those people, if you educate her on who you can help, she'll eventually learn the people to send you, and you'll start getting those good referrals coming from them. That's just an
very,
idea.
yeah, that's great. I love it. Hey, I want you to skip number 3, not because it's compliance, because of time. Go ahead and skip number 3, because I'm going to get Lisa to send this out as well, if that's okay with Lisa, so that people can have this letter. So just skip this, especially now that we got Paul Tyler on the call for compliance. We'll let him handle that later. But we want to provide real value, and that's what we keep going back to. Okay. So when you're doing these things, you're giving free seminars, you're giving those consultations, and we talked about the libraries, the churches, and 101. When you're meeting with people 101, what I did was I had written all these people during AP for retention purposes. I always reach back out to them, say, hey, because now I don't know if you all probably have the GTL product or have some type of hospital indemnity that you can show somebody now that'll help it'll help the financial burden of that hospital copay on some of the plans. You know what I'm saying? And so now you can go back in there with them. And when you go back in there with them, even if it's just to show them that, make sure they're using their plan, you ask for referrals. And that's where Lisa used to always say, don't keep me a secret. You don't ever, that's what I always told people, don't keep me a secret. And I know that's the biggest thing. So leads come naturally when people trust you first. So just remember that. Um, Simple tools and resources, plain language handouts, Medicare checklists, turning 65 checklists that a lot of times can help folks when you're at these events and things like that. I thought this was brilliant when I was doing some research, but newsletters, if you ever have some places where you're going consistently, what if you created like a little newsletter for them, to give out? Let's say you're working at or you're at a senior location and they allow you to do that. They give you permission to do that. So just remember things like that. Also have a digital presence. Now, when it comes to Facebook, and tell them what you do and things like that, there's all the rules and things like that. I'm not on Facebook, but a lot of people are. A lot of people have success. Okay. And the biggest thing is, I just wanted to say this. The key thing out of this is the agents who win long term are those who position themselves as trusted educators first, salespeople second. Community sends business to the person they know, they like, and they trust, not the person who's hounding them for sales. Okay, so just remember that when you're doing everything. So, Lisa, would you go to the next slide? I want to make sure I cover this because I know we're running low on time. Um, this is some things to think about. I know that if you've been in sales forever, you've been doing things your way naturally, and you may know how to do this, but these are some things you can say to people if you're ever just struggling, especially I know there's a lot of new agents on here. But after you wrote somebody up, I'm so glad we got your cover sorted out. I build my practice mostly through referrals. If you have any friends or family members turning 65 or confused about the Medicare, I'd love to be a resource for them. And then, just ask them, does anyone come to mind? Just make sure that's when you hand the card. That's when you get it in their hand and you tell them, say, hey, look, there's these, I can't just call people, so encourage them to give me a shout. And I will do the same thing I did for you, hopefully today, and help them, with their health care. Okay. When you meet with them, we talked about outside of AEP, let's say you do like an annual review, or in AEP, let's say you whatever time. Before we wrap up, do you know anyone turning 65 in the next year or someone frustrated with their current plan? And just remember, I never pressure anyone. I just try to make sure people have someone that they can call with questions. So once again, low pressure, you're showing that you're a service and you're making them think about referrals constantly. And then this last thing, this is like, how would you describe this, Lisa? Soft plan. Here, let me read this. It says, if you ever hear someone mention Medicare confusion, just send them my way. I'm always happy to do free consultations with no obligation. So little things like that. I know that some people, like I said, you know what to say. You've been doing this forever, but it's good sometimes because when I was at Humana, and I remember we were doing a meeting, and there was about 13 of my direct agents or whatever. We were sitting around the table and we're talking about it. Almost 90% of the agents in the room admitted to not asking for referrals when they got into the appointment because they get so wrapped up in making the sale and closing that person that they didn't talk about their value and what they could bring and all that stuff and giving out those cards. And I'm talking about, and then we'd have bigger meetings and then 75% of the room didn't do it. And my mind was just blown because that's how I was always wired. Ask for referrals 3 times at the beginning. I'd say, hey, as we're going through this, if anything pops out, anybody that this could help, write their name down, think about them, and give them my card. And then in the middle of it, I'd say something. At the end, I do some kind of same deal like we're talking about here. So I know y'all are annoyed with me talking about referrals all the time, but it is the key to business. So, and Lisa, any thoughts?
It is. You'll always find your own way to do it. And it will just become your way. I know, one of the ways that I did it at the end was I always made a joke out of it. I always used to just say, okay, so I'm going to leave you with some homework. And, you're usually dealing with older people. And I would go, how long has it been since you've had homework? And they would laugh and I would laugh. And then I would go, you've got 3 business cards here. And I need you to give out these 3 business cards. That's your homework. And, it would always be funny because they have homework all of a sudden and they haven't had homework in years. So that was always my joke for the day. So
That's pretty
if you make it funny and you make it your own way, it was always something that you would remember to do in your spiel. And it was just something that they would remember to do. So just make it your own. And when you make it your own, it just becomes part of your presentation. And if you can find something that just works in your spiel 3 different times, it just becomes part of what you do. So don't make it something difficult. Just make it become part of what you do. Because it's not difficult when it becomes part of your spiel.
That's right. Hey, Lisa, we got about 3 minutes. Go to the next one if you don't mind, real quick, because we're talking about asking partners. Now, this is when you're in the field, okay? Maybe you're talking to a doctor, and some of y'all, I know y'all do it different. Since I work with many patients in this area on the Medicare coverage, I know you can't recommend me specifically. Maybe they can, but anyway, but patients come to you confused about their plan or losing coverage. I offer free consultations and here, can I leave some cards at your front desk? And that's when you go in there maybe for the first time, you're talking to them, and then you're just building that relationship with the staff. Also, and just remember, all this is about planning things in their head. So will you come to mind when they're doing stuff? Okay. Financial advisor. A lot of your clients are probably hitting 65 and thinking about retirement. Medicare decisions can really affect their overall financial plan, drug costs, supplement premiums, and those sort of things. Would you be open for a quick coffee so I can show you how we could add value for their clients? Now financial advisors are going to love you, and then they're going to ask you for 3 people they can call at the end. So I always give them Rick Linder's name. I always give them Jim Toll's name, and I give them Paul Todd's name every time. So they'll say, if you get calls, y'all. Senior center directors. Hey, I'd love to offer free Medicare Q&A sessions for your members. No selling, no, just education. A lot of seniors have questions that they don't know who to ask, and I can tailor to whatever topic you think your group needs. Next page.
Say something real quickly about that, Josh. I think that what you have to do when you're going in these places is make sure that when you pull up there and you sit in your car before you walk in, you've got to think, this is not about me. Because we have a tendency to think, what can I get out of this? Do not walk in these places thinking about me and what I've got to get out of this. It's what you can do for them. And when you walk in with that mindset of what you can do for them and what you can help them do, you're walking in with the right mindset, and everything you say will come out correctly. Okay.
Servant leadership.
Yes. Because if you walk in with what you need, nothing you say is going to come out right. And it's not going to go over well. So just remember, it's got to be what you can help them do. Okay. So that's just my key point on that.
No, that's good. I need to take that into marriage, Lisa. Servant leadership. I just had my 15th anniversary, and I'm still learning that right there, that concept. Yeah, and then look, she's going to send these out, but here over the next few pages, there's going to be multiple scripts for when you first contact from the referral. If they want to think about it or have a hesitation, and then just thanking people. I just put a bunch of different situations that I could think about that I thought may be helpful for everybody. So you may know them, you might not use any of them, think they're silly. You may pick one that you like, but you'll have this. So just remember my number is 334-268-8843. That is 334-268-8843. And if you want me to send you a Medicare 101 or the HR thing, just text me or email me or whatever, and I'll get it to y'all. But thank y'all. If you have any questions, send them to Lisa. I'm just joking.
Josh, thank you so much. This has been awesome. I appreciate you. You did a great job. Thanks, Josh.
Y'all be good.
Thanks, everybody, for joining. We appreciate you being with us today, and we'll get this sent out to you. And listen, good luck. Once we get past OEP, you have to be very creative and come up with things. And Josh and I are here to help you do any of those things and come up with ideas. So if you need us, just give us a call. That's what we're here for. Next is Heather.
That was great.
There we go.
I think I'm done. I think this is not going to apply to me.
I think that everything that you guys talked about today could really carry over to ACA.
Absolutely.
Just fantastic.